Kadi? Other cut. So this is how he looks now. Our dental surgeons, they have done a beautiful job. You can see how he's got perfect smile now. He had a major accident. He had wrecked both his upper and lower jaw. Some of the minimal scars are still there. I've got the arch bar still in place. That's how he looked. You see that? So after the jaws were fixed, our dental surgeons have done some root canal treatment. They've done some work on the gums, and eventually they've given him nice permanent ceramic restorations, zirconia restorations. And these are the braces, or like the arch bars we call them, that are still there because he had a fracture also that was running down here in the dental segment. Once that heals, then we're going to do root canal treatment for that, and then even that's going to be taken care of. So this is to tell you that even if you have a bad accident, we're able to get you back your smile, we're able to restore your teeth, we're able to restore the way the gums look, the way the occlusion was, the way the jaws was, and the way he can function. Why, Tora? Allah. His mouth opening is still a little bit restricted. Kadi? One of you kadichu chaapirukkalanga sarka? Illa, vali illa. He has no pain, he has no problem opening and closing his mouth, and ipo pallu nalla irukum. அடுத்த 2 வாரங்கள் கழிச்சு வரவுல கீழே இருக்கிறத கலத்தி கீழே பண்ணி கீழே முடிச்சிருவாங்க. அது வரைக்கும் நம்ம வெயிட் பண்ணணும். ஆனால் கீழே இன்னும் லைட்டாக ஆட்டம் இருக்குது. அது செட் ஆகிறோம் பார்ப்போம். இங்கே கொஞ்சம் வீக்கம் இருக்கும் அதில். அது கம்பி எடுத்த பிறகு அந்த வீக்கம் சரியாட்டனா உள்ளே இருந்து லைட்டாக நம்ம அந்த வீக்கத்தை சரி பண்ணி கொடுத்துருவோம். சரியா? Okay, Doc, you want to explain dentally what was done for him, maybe how many days it took or something, so that they understand what exactly went through?
So he came to us like this. So he had met with an accident, I think 2 months ago. 2 மாசம் முன்னாடி accident ஆச்சுல. 2 months ago, and we have done an open reduction technique for him in the lower and the upper jaw. And for the teeth, yeah, we have done root canal for him for the abutment, and this is crown which we have given for him. So it didn't take much time. So for the crown, yeah, it took a while to come because of the COVID. We had to wait for a while. So it took one week's time. Oru 1 week la ungalku pallu koduthutomla. Yeah, it took 1 week's time for him to get the crown. Now he is happy with the crown, and we'll start with the lower very soon because it's not it's stabilized yet. So open pannunga. He is having little mobility in his lower anteriors. So we are just waiting for that to heal better, and then go for a crown again. Yeah. Okay. Half an hour ku onnu saapda venda. Okay, thanni saapadu edhum venda. Apparama you can eat anything. Munadi vechi edhum kadikka venda. Okay. So apple or murukku edhume vandu front teeth vechi use panakudadu. Okay, like pinadi paal vechi dhaan kadikkanum. Okay. Edhachu pain irukka ungalku?
ஜாயின் பண்ணிருக்கீங்களா? இப்படி
கடிக்கும்போது உங்களுக்கு லைட்டா பெயின் இருக்கு. That's fine. It will settle down very soon, okay? Yeah.